Hello, I am Jessica Ologbon. I have just completed my third year of medical school at King's College London, and this is my personal statement analysis. So this personal statement got me into King's College London, Cardiff University and Queen Mary University of London. I'm also a gap year student, so when I first applied to medicine, I was unsuccessful and I reapplied. So I do touch on what I did in my gap year in this personal statement. So I decided to structure my personal statement into 6 paragraphs, focusing on 3 main themes: my motivation, why do I want to study medicine? My exploration, what have I done to learn about medicine and prove that I'm ready for it? And my suitability, why am I a good fit for medicine overall? And my first paragraph is an introduction to why I want to study medicine. So here I'm really focusing on my motivation. And I talk about the fact that medicine is a truly unique vocation that combines empathy and care for others with the application and progression of science. And that in itself is going to provide me with personal fulfillment. I also allude to the fact that my academic interests and achievements have made me come to the realization that I want to be a doctor. And I will talk about these in the rest of my personal statement. My second paragraph focuses on exploration. So what wider reading and study have I done towards becoming a medical student? I mentioned here that biology and chemistry have been some of my favourite subjects in my A-levels, and that I've gone beyond the curriculum, attending STEM programmes and taking up my own research project, investigating the link between psychosis and cannabis. And in order to do this project, I have to demonstrate problem solving. I had to write a report. I had to critically appraise literature, come to clinically relevant conclusions about that literature. And it gave me an appreciation for the mechanisms and complexities of the human body, which essentially is what medicine is all about. In paragraphs 3 and 4 of my personal statement, I talk a lot about my work experience, and these were key questions that were brought up in interview. I spoke about volunteering as a support worker for MenCat Disabled Trust during my secondary school years, and this shows capacity for sustained work. When you're 14, 15, 16, you've obviously got school to go to and you've got to manage that time with other things. And volunteering for a long period of time at this disabled trust really gave me an insight into working with vulnerable people. I kind of say here that I was initially anxious and apprehensive, but I learned to deal with situations sensitively and patiently. So I grew my confidence. I had to take part in personal care, looking after people who couldn't look after themselves. And at a young age, it's good to get an idea of what that will take early. I also talk about the fact that I undertook work experience at a hospice and a hospital, and I drew comparisons between both of those at my interview because I was asked what were the differences and what did I learn from each one. A hospice focuses on end-of-life care, and when you're in a palliative setting, you really do understand that sometimes patients cannot be saved, and the most important thing is making them feel comfortable. And I really realised that a doctor's duty of care extends beyond that of a patient, but also to their family and their friends and their relatives and everyone who's going to be impacted by the loss of that patient. Whereas in a hospital, a lot of the conditions are acute, or even if they're chronic, they're being managed. And a lot of people get treated and leave. And I saw how quickly it could be from admittance to discharge. So it was a big change in the way that patients are managed, and also how busy both settings were. A hospice was a lot more calmer. Again, we're talking about end-of-life care. We want to make people feel comfortable and at ease, whereas the hospital is a very busy location. Lots going on, lots of problem solving, diagnosis, treatment going on. I mentioned here that I valued the range of skills demanded by the profession, and I list them, which is really important when they ask you in an interview, what work experience have you done that proves that you want to be a doctor? What skills or qualities did you see on your work experience, and how have you demonstrated them yourself? And I highlight here the compassion needed when working as a doctor in any setting, to truly empathize with patients feeling a variety of emotions, including fear, depression, and a loss of control. And what I'm showing here is that I've got the communication skills. I've identified those being shown in healthcare professionals, but I also go on to talk about how I show these myself. I've been honest and shown integrity, and also, as I mentioned before, compassion and empathy is really important for a career in medicine. My 4th paragraph again focuses on work experience, and I decided to dedicate this paragraph to what I did during my gap year. And this again brings up the fact that I can do sustained and intense work. I've been working as a healthcare assistant at Hammersmith Hospital, and I partook in the treatment of patients from their admittance to their discharge. And as a healthcare assistant, I wasn't a work experience on the outside looking in, but I was actually one of the team. I was doing 12-hour day shifts, night shifts. I worked directly with nurses and doctors to look after patients. And I say here that I recognize people's pain and concerns without losing focus. And I took time to listen and communicate honestly with patients, relatives, and staff from a variety of backgrounds. And these are key skills that you're going to need if you're going to work with people as a doctor. And again, I say these are essential qualities, and it allows us to go beyond the science of an illness and understand how it actually impacts patients' lives. And that's one thing that being a healthcare assistant really taught me. And I was asked about that again in my interviews. What did I learn from being a healthcare assistant? Why do I think this makes me a better candidate for medicine? I also showed these skills in my role as a St. John's Ambulance volunteer, where I actually taught first aid and CPR to young people in the community and those who are unemployed, to give them the skills to then enter into employment. So I'm demonstrating NHS values here, being honest with patients, listening to them, remaining focused, being able to look after people from a variety of ethnic and socioeconomic backgrounds, respecting other people. And these are all important that you demonstrate and let the admissions tutors know in your personal statement. In my 5th paragraph, I talk about my extra study again. So I was interested in the recent epidemics of Ebola and Zika at the time of applying, which was 2017. And I completed a project with the London School of Hygiene and Tropical Medicine, again via Moodle, to focus on the causality between Zika and microcephaly, which was abnormal head growth in newborn babies. I realized how such conditions affect future generations. So although mothers were coming down with Zika and could be cured, microcephaly affects a baby for life, and this has severe social and economic cost. And I decided to travel to the Dominican Republic to work in a hospital for 3 weeks, where I gained an insight into the diagnosis and control of Zika. And I was actually on the obs and gynae ward, so I got to see babies with this condition in real life. And I did this program with Global Pre-Meds, and I also saw the treatment of diseases that were no longer prevalent in the UK, such as cholera, dengue, yellow fever. And this is really interesting, kind of makes the admissions tutors think, wow, okay, this person's got an idea of what health looks like on a global scale. And I say here that I'm excited at the prospect of being at the forefront of scientific and technological advances, together with direct patient contact, which essentially is what medicine's all about. Again, I'm showing intellectual curiosity here and problem-solving skills. In my penultimate paragraph, I like to focus on extracurricular. So how am I suited to medicine? I know that I've got the work experience. I've tried to explore my passion for medicine. I've tried to show my motivation for it. But how am I going to show that I'm a well-rounded individual? Well, beyond my academic interests and volunteering, I'm passionate about music and drama. And I'm a grade 5 pianist, and I've played at local concerts. I'm also a member of my theatre group, and this is overall been great fun, and it shows that I have interests outside of medicine. And in an interview, you'll be asked, what hobbies do you have outside of medicine, or how do you think you can keep up with the pressures of medicine? And it'd be amazing if you could say, you know, I'm passionate about this and I want to join your university societies. I want to join the music society, the drama society, because I've done this, this, and this. And this is a great chance to talk about things that you've done outside of school. And it also, most importantly, shows time management. So alongside all of your studies, all of your work experience, all of your volunteering, you've still got time to do things that you enjoy and have time for hobbies, which is going to be really key when you're a medical student, because you don't just want to give up your hobbies when you get there. Finally, the conclusion. So this is where you hammer home again what your true motivations are, and you reinstate what you've said so far and why you want to study medicine at this university. And for me, it was that being a doctor is not simply a job, but a life commitment. The dedication and care that I saw throughout all of my experiences have prepared me for the lifetime of learning that is going to take place once I get into medical school. And again, you're reminding the admissions tutor here that you've got a realistic insight into medicine and kind of reinstating why you want to still do it. Thank you for listening, and I hope that helps.
If you would like to get expert feedback tailored to your universities, complete with individualized analytics, check out our Medicine Personal Statement Review service on the Aspiring Medics website. It's the most cost-effective service on the market, and we've had glowing feedback from students. Don't forget to like, comment, and subscribe if you found today's video useful. See you in the next video.